Ruth Maguire to be followed by Brian Whittle.
Presiding Officer, can the Cabinet Secretary advise when social distancing measures should be followed and confirm people who have symptoms in keeping with COVID-19 should stay at home and self-isolate?
Cabinet Secretary.
So there are a number of steps to social distancing. The first of those we have taken, and that is the advice to individuals who have those symptoms indicative of the virus, that is that persistent dry cough and fever, to stay at home for 7 days. Other measures will include what steps we need to take for the two vulnerable groups in particular that I mentioned, those with underlying health conditions and those of our elderly population. And we will provide more advice in detail to both of those groups in the coming days. All of that requires all of us. I mean, I think the important thing for me to say again, Presiding Officer, is that this will affect all of us. Most of us will have mild symptoms. All of us will have a different way of conducting our daily business than what we are used to now. Life will change for all of us. For some of us, it will be more dramatic a change than for others, and therefore for all of us, we have a responsibility to help each other to get through this particular situation. Compliance with the measures that we are setting out today and those that will come in the days ahead are important. They're important that the members of the Scottish public trust the advice that we are given, that it is based on the science and on the clinical advice, and that where we are exercising judgment over that, then we make clear what that judgment is that we are making that leads us to take specific measures in addition to what the science and the clinical advice advises us. The measures on social distancing that we will bring forward over the coming days and weeks will be measures that are clearly assessed as having the maximum impact to delay the spread of the disease, reduce the peak of cases at any one time, and protect those that are most vulnerable.